Welcome back to Listens Live. Joining me now is Dr. Regan Ackerman from Freedom Mini Dental Implants. Dr. Ackerman, always a pleasure to have you on the show.
Always. Thank you for having me.
Of course. So a lot of what you do is pretty unique to your office, and some of the stuff that I've seen you bring in, some of the pictures that you've shown me, I'm always super impressed with what it is that you do. But for those who are unfamiliar, tell them a little bit about yourself.
Yes. So I have focused my practice solely on what we call mini dental implants. The mini part just means it's a smaller diameter, less invasive implant, usually less healing time, less costly than the bigger surgical implants. And I use this in many different ways. I can replace one tooth or two teeth. I do what we call denture stabilizations. People struggling with flopping dentures or using glue, we can snap dentures onto the mini implants, or we can get rid of the denture altogether and do permanent teeth. But the great thing about the mini implant is it's, like I said, a lot less invasive, and people that were told maybe they weren't a candidate for the bigger surgical implants could be a candidate for the mini implant. And we'll find that out. You come in for a consultation. It is no charge for the consultation. I do a free consultation. It includes a 3D x-ray to make sure you're a candidate, so I can look at your bone and measure it. And I'm the only dentist there. We're a small practice. My husband works with me. He's the one that will take your x-ray. So we always say our patients become family to us too.
And here's my favorite part of your spiel, and that is showing the bone.
Yes, 100%. So this shows just how less invasive the mini implant is. Like I said, it's just a smaller diameter size implant. I am not making this big hole right here like the more surgical implant. I don't have to do an incision, don't have to place this and let it heal for 3 or 4 months. This is what I am, the little pilot hole I make when I place an implant. So I'm not making any incisions or stitches, just local anesthetic, make this little pilot hole, and then it's just a smaller diameter that, you know, goes into the jawbone. And the day I put the mini implant in, like for a denture stabilization, you leave with the denture snapped onto the implant that day. But this just shows how much, you know, I don't have to have a ton of bone. I always just say I have to have some bone to place my implants. So if you were told you needed bone grafting or a sinus lift, a lot of times, you know, you can be a candidate for the mini implant without those procedures.
You know, if you're not sitting close enough to the TV, you almost can't even see the hole.
Yes,
it's so small. But I know we've got a couple examples we want to get to of people that you've helped, and we've got some before and afters. The two of them specifically are using the permanent, correct?
Yeah, so this is Miss Donna. She came to me, you know, obviously had broken teeth, failing teeth, knew she needed all her teeth removed. So we did the permanent teeth on her, which we'll show the model later, but so those upper teeth are cemented in permanently, and she has nothing on the roof of her mouth, so no denture on the top. And then she did do what we call a combo. She did the snap-in denture on the bottom, so she has permanent teeth on the top and a snap-in denture on the bottom, but she can taste her food. She can, you know, bite into steak and burgers and, you know, eat pretty much whatever she wants with those.
And do you want to go ahead and look at the model now while we've got,
I
got those in front of you?
Yeah, so this is what Miss Donna has on the upper, which is a great option to get rid of dentures completely. So these are the mini implants. When I place these, like I said, you know, just numb you up with local anesthetic. I'm not making incisions or stitches. You're not going to leave, you know, the office bleeding. And I'll place these implants, and then we're able to make just a bridge of teeth for you, okay? And then this gets cemented permanently onto those implants. So people that wear dentures know a regular denture covers the roof of your mouth and you can't taste food. Denture moves and flops. So this solves all those problems. Now you can taste your food. You don't have to take anything in and out every day. You don't have to use glue. You brush these just like regular teeth. We give you kind of a water pick to keep them clean. You get them cleaned every 6 months, just like regular teeth. But this is a fantastic option, especially people that are struggling with dentures and want to get rid of the denture completely.
So it's just snap in, cement, forget about it.
Yes, just like regular teeth. You're going to brush them just like regular teeth every day.
And we've got one more person to show, and that is doing the same thing.
Yeah, so this is Miss Kelly, a fantastic patient. We had so much fun treating her, but she has the permanent teeth on the upper as well. She kind of knew, you know, those teeth were failing and needed them removed, and she did not want to have a denture for the rest of her life. So we did the permanent teeth. teeth. Like I said, she has nothing on the roof of her mouth. She gets to taste all of her food, and has that confidence to know, she doesn't have to take anything in and out, that these are kind of the closest thing to her, regular teeth. And of course, improved her smile, gave her kind of that confidence to smile again.
Like the example that you've shown us is one big piece, and that might be great for a lot of people who just have had problems keeping their teeth intact in general. But for some people who may have experienced maybe some trauma in their mouth or just need a small area, you've also got these individual pieces or small pieces that you can use as well.
Certainly, yeah. It doesn't always have to be your whole mouth, all of your teeth. Like you said, there are people that have lost a front tooth for whatever reason, a sports injury or a car wreck. So I'm able to do a single tooth as well, place the implant, and then you don't have to wait 3-6 months to a year for this all to finish. Usually, you come back usually about 4 or 5 weeks, and we'll have the permanent final tooth, and then that gets cemented on to the implant, so it doesn't come in and out. Same thing if you're missing, 2 or 3 teeth in the back. A lot of people are missing their molars. We call them your chewers, and you can't chew food up anymore, and you really need to replace them. So, I'll place a couple mini implants in a row here, and then we make a bridge where this gets cemented on permanently so it doesn't come in and out. So people that have what we call a partial or a flipper to replace, a single tooth or multiple teeth, and if you've got it, you know what it is because you hate it. So I can place these mini dental implants and get you out of that. And like I said, the mini dental implant is just a lot less invasive and usually a lot less costly than the bigger surgical implants, and the time of treatment is a lot less as well.
And you can learn more information, get that cold hard tooth at freedomimplants.com. Dr. Ackerman, appreciate you coming on.
Thank you.